So thank you very much for those of you that have been able to attend. In the interest of time, I'm sure people have busy schedules. It's a Friday. I know I have a class at 18, so I wouldn't want us to drag this any more than we should. So today's and I have to apologize here. I'm in transit right now, so I'm using my mobile device, hands-free, obviously. Today's presentation, ideally, it was supposed to have been done back in, I don't know, it's May or June or something. It was supposed to be it was supposed to have been a proposal presentation, but because we're doing this a couple of weeks after Festus and Puka were supposed to have done this, what they're presenting is actually their progress. So Festus and Kuka are working on a project which is an extension of our enterprise medical imaging in Zambia project, where we are working with radiologists from the investigation hospitals, and recently, so this year, the Cancer Disease Hospital, to try and improve the efficiency and effectiveness of radiological workflows, in as much as the investigating hospitals, Department of Radiology, and now the Cancer Disease Hospital, um, are being used as study sites. We are actually undertaking these projects in such a way that we can easily scale up what we are doing to these other public health facilities. So our obsession is really public health facilities. Um, so we actually are working very closely with the current, I think, acting head of department of the Cancer Disease Hospital, Dr. Lena Lambert, and also to a certain extent we have an expert who is a part of the project, Dr. Zola Mahlaza from the University of Cape Town. It turns out that he's the one who's been in charge of work package number 7, which is tied to automated, generation of radiological reports, if you will. So Festus and Kangwa's work specifically focuses on cervical cancer. This was an explicit request from our collaborator, Dr. Lena Lambert. And I so wish, Festus and Kangwa, I so wish we had extended an invitation to Dr. Lambert. It's too late now, though. So I'm going to hand over to you guys, and then we can do this. I would like to encourage those of you that are sitting in to please ask as many questions as you can. The idea behind these research progress presentations or these seminars is to give each other feedback. I'm especially keen to have senior students like Mala is you, I suppose, and people like Muanga, right? I see you are logged on to give feedback because you have experience with this. Muanga recently, well, graduated. He was graduating in May here, so he sort of like has experience in terms of what you do as part of a capstone, project, if you will. So over to you guys. Let's do this. Thank you.